Turns out there's not a lot to dread about the dreaded Omicron variant of COVID. We know this because the biggest study in the world of Omicron has just concluded. It involved researchers from all over the country, from CDC to Cal Berkeley. And here's what they found. Of the 52,000 patients they studied who had the Omicron variant, none required ventilation. People with natural immunity had lower infection rates than people who hadn't been previously infected with COVID. We knew that. Now, given that 98% of new COVID infections are from the Omicron variant, this suggests maybe we need to change our approach to the so-called pandemic, which may no longer be a pandemic. We're not sure. And that's why we've asked Dr. Marty Makary of Johns Hopkins University, he's professor of public health there, to join us tonight. Professor, thanks so much for coming on. So this study seems, I don't know if conclusive applies, but it seems powerful. What do you conclude from it?
This was a remarkable study. It was massive, and it's no longer an open question. Omicron is clearly more mild. This affirms the bedside observations and the laboratory data that it's not infecting the deep respiratory system. It's staying in the upper respiratory system.
Yes.
You know, they found 52,000 people with Omicron, but that probably represents about 250,000 Omicron cases in the community. None required mechanical ventilation. Of the 154 that went to the hospital, 84% had a less than 48-hour stay. Now, if you remember, the South African doctors 2 months ago noticed that very few hospitalized patients during that Omicron period were in the ICU. And they told us that the average length of stay was about 2 days. But yet, we ignored that advice, and they said very specifically, do not panic. This is a mild virus. That was 2 months ago. U.S. public health officials sort of dangled it as an open question that Omicron could be more deadly, that it could be as deadly, and there's a small chance it could be less deadly. Well, the reason this is important is that less than 1.7% of new cases today are Delta. The vast majority, 98.3%, are Omicron. Yet our policies are based on Delta, a different virus that behaves differently, that has a different infection fatality rate. So all of our policies, the mandates, the excessive testing, the excessive and cruel quarantine periods that are destaffing our hospitals, they are based on Delta. The SCOTUS ruling, the Supreme Court ruling, used Delta data, even exaggerated it, and made a ruling during a time when we now have a different virus, a virus with a lower severity rate than influenza. And we've got 50,000 to 70,000 people a year with influenza and a bad flu season in the hospital at any one time in the middle of that influenza season. That's what we have right now with COVID. We have about 60,000 to 70,000 people in the hospital for COVID, not just with incidentally, but for COVID. And we have the differences from influenza. We have a staffing crisis right now. 10 to 25% of the staff in healthcare have left, many permanently. Many of them have natural immunity. They were fired. Ironically, they had antibodies circulating in their blood that neutralize the virus, but they are antibodies the government does not recognize. People want the science. They want it straight. And what I find, Tucker, is people are just hungry for honesty with the data.
The lying has been mind-boggling. So maybe what we should do is, I don't know, send 100 million COVID tests to asymptomatic people to just scare the crap out of them. Do you think that's a good public policy solution to this?
Well, their plan to do it is after the Omicron wave. We'll be at very low levels in 4 or 5 weeks in most of the country. By then, people are going to be so sick and tired. They're not going to care about a very low level of a mild virus that acts like the common cold at that point. So many of these policies are spending a lot of money, then it's going to come far after the current wave.
Yeah, it'd be interesting to see who has stock in the testing company. Doctor, I appreciate your coming on and for the clarity of your analysis. Thanks so much.
Thanks.